Okay, cool. Right. So thank you guys for joining this call today. I've got the lovely job of hosting this call and just making sure that everything runs smoothly because Connor was selfishly on annual leave today. Um, for anyone for our three people in the audience that have joined us for this live talk, and then anyone that watches this as a recording after, what we wanted to do is to bring all of the senior leadership team from Valorum Care Group and our brands to talk about their mental health. Because it's Mental Health Awareness Week, and how their mental health may or may not have been affected through lockdown. In particular, working from home, not being able to get out into the services, and all those sorts of things. So this is going to be a bit of a free dialogue. I'm going to be throwing some questions out there to specific people, but this is really for you guys to have a bit of an insight into how we're affected as well. So the first sort of question and the first topic I'd like us to talk about is really what has been your experience over the last 2 months during lockdown, and have you noticed any change to your mental health at all? So if there's anyone that wants to kickstart, or I'm more than happy to nominate someone. Esa, okay, please, off
I
you go.
would like to kickstart because I had something happen to me yesterday that made me realise. I know we're talking about our mental health and staff's mental health, but it's quite an eye opener. Yesterday, I had to take my son to A&E. He's fine, don't worry. He's just a 10-year-old boy that has accidents. And when I told him he had to go to A&E, he had a severe panic attack because he was worried that he was going to die in hospital of coronavirus. And it really made me open my eyes that actually I'm aware of my mental health and my husband's mental health, because we show that by being in a bad mood or being very quiet or withdrawn. But actually, children just, I think, store it in their heads and don't physically show how they are managing in this situation. And so, yeah, it made me really aware that actually, I don't think we've taken into account, or I certainly haven't taken into account, children's mental health, which then has affected my mental health over the past 12, 18 hours, because I feel terribly guilty that I've been thinking about myself and my husband, because we show our signs and symptoms of our mental health, and my son hasn't. I don't know if anybody else has experienced anything with their children.
Have you found that there's been any support out there for you, like from schools or any
Uh,
other groups or anything?
no, schools really is, they're just supporting with helping with the homeschool learning, but nothing for the children's mental health.
Mm. Has anyone else experienced similar?
I mean, I receive a call every week from the school asking how the girls are and they're managing with the homework and how are they feeling and how they managed to get exercise. So I think that's a really good thing from the school. I mean, I received one today when I was out in the service, and it's a genuine call. So I think we do forget about children because we're so busy wrapped up in our day-to-day lives. So yeah, when Essa's mentioned it earlier on, it was quite poignant really, because I just think, yeah, we do forget.
Mm.
I think as a whole, I think we all forget about our own mental health. I think we put it to the back of our minds. I think when we're talking about physical illness and physical ailments, it's something that we generally shout about. We're quite happy to shout about. We go down the pub if we broke our arm, and we kind of say, "Now then, lads, look what I've done." But not one of us go down to the pub and say, "I'm really depressed today." And I think in this period of lockdown, we've had a lot of communication, all of us, and I think in many respects the fact that we've had those morning calls, whether it be the COVID-19 clinical governance group or whether it be the senior leadership team or the board meetings that we've had, I think in many respects, I think that's probably added to each and everybody's sanity. The fact that we have been isolated, but we've still had interface. We've been able to talk to people, and if we've got an issue, we've been able to share it, and we've been able to work through it. I know I speak to Esa and Paula a lot more probably than I do with anybody else, and if we've got a problem, we tend to share it and talk about it. And I think the technology that we've got at this moment in time, had we not got this kind of technology and sitting where we are, I think, do you know what? I think it might have been a totally different landscape that we're looking at.
Mm.
Yeah.
Mm.
Yeah.
Has anyone else got any experience themselves? I mean, from what you've said, Tom, I do agree. Like, I think if we didn't have the technology, we'd be in a completely different place. But I've certainly felt my mental health affected through the lockdown. I mean, last week for me was probably the most emotional week that I've had for such a long time, and I don't really know. There wasn't any particular reason why. I just felt really down. I kept waking up every morning and doing my normal routine, but I'd just be like, oh God, I just wanted to cry. I think I even spoke to a couple of colleagues and they said, how are you doing? And I said, I just want to cry. I was bickering with my partner over absolutely nothing. And then we're bickering about bickering, and it was just, and there's nowhere to escape. So you're just like a pressure cooker that just can't ever, you know, we can't sort of dissolve from the bickering that we've had. And yeah, we just couldn't. It took until the weekend where it was like, oh, I can relax a bit. Yeah, I don't know what it was. I don't know. I can't say, do I feel, was it pressure at work? Is it pressure for feeling that I'm, you know, putting pressure on myself, like I've got to go out and get my steps in, I've still got to be eating well, otherwise I'm going to get fat. You know, I don't know really where it came from, but I found last week I just hit this wall. But this week I'm completely different. Maybe it's because the sun's out, I don't know, maybe it's because it's bank holiday. I can't put my finger on it, but I felt awful last week, to be honest with you, but completely different this week. And I even, you know, I went onto the big white wall. I felt so rubbish one morning. I was like, I can't focus. So I went onto the big white wall, and then I think someone called me, and then that was it. But you know, that is out there. So I do want to go in there, because I'm sure there's going to be another down day. I don't think, oh right, that's it, I'm going to be fine now. I'm sure something else is going to happen, and I think because we're in this situation, I don't know, I think maybe I'm a bit more sensitive and emotional about things. So something that probably I'd usually brush off. You know, if James annoyed me, I'd be like, yeah, whatever. But because I have to see him again and again, I'm like, ah. So yeah, I'd say I've been a bit more affected last week, but this week I'm all good. But yeah, I don't know. If I didn't have the technology though, it would be really, really difficult. Can't ring up my family, friends, colleagues, etc. But sorry, I've been waffling for ages. Has anyone else?
Yeah, I think so, Katie. I think probably for me, you know, we've now been in lockdown for 8 or 9 weeks, haven't we? The first couple of weeks, the working from home was something that I was quite enjoying, and I consider myself quite an introvert, if I'm really honest with you. And I was looking forward to sort of that introversion, but actually, I really missed seeing people, being in the office with people, just being around people. Just having those silly little interactions that you have in an office, I've really, really missed those. I think the other thing that I found difficult is the drive to and from work was my sort of get myself into work mode and then debrief from work very, very briefly on the way home. And so there was sort of, I don't know, I kind of call it work Tom and home Tom, and those two things just have just morphed into one. So I roll out of bed early on a morning, and within 2 minutes I'm sat at my desk, and then I'll go and have tea on an evening, and something about work will pop into my head, and I'll just come back in. And actually it's become a bit of a comedy in this family now. I've just got 5 minutes worth of work to do, and then next thing I look up, it'll be 10 or 11 o'clock at night and everyone's gone to bed and I'm still downstairs working, and I'm like, how have I just lost 2 hours? So I think that's probably the hardest thing for me. And Katie, sorry, just to agree in with you, I'm definitely on a roller coaster. Some weeks I'm great and some weeks I'm bad, and I just don't understand why there is those differences. And yeah, it is a bit of a strange one that it is affecting me too.
Yeah,
I think I can echo that as well. So probably myself and Paula, and maybe Tom P. You know, we spend a lot of our time traveling the country. So I may sometimes be 5 hours to get to a service. And so I have that whole 5 hours of me time and reflection, etc. And then I spend a couple of days in a service. So, you know, I get to spend time with the people that we look after. I get to support my managers, my regional managers. And I'm really missing that interaction and the my time too.
Esa, you mentioned a word there, guilt.
Yeah.
I think we're naturally, certainly our management in First Enable have always prided ourselves on leading from the front. I suspect certainly at First Enable there are, because we've had to kind of like, you know, isolate the services effectively, you know, and create a different type of leadership through this. The guilt that we're sending our staff into potentially a dangerous environment, if you like, and not being there to kind of share that is I know certainly I've certainly lost sleep from time to time over this period of time, because something has triggered a response off into my head and thought, have we really thought about this? You know, and I'm not there with the staff to sort of, you know, and funny enough, somebody mentioned a comment on a LinkedIn page just the other day that I was writing to, you know, and sort of brought it home a little bit that, you know, we're making these decisions, we're doing this from the relative safety of an office or whatever, and our staff are in there on the uncertainty that is supported living or resident, you know, care home or whatever. It's so for me, the guilt thing has a little bit of an effect on us, and I speak for all the management team that are, you know, having said that, if something was drastic to go wrong, we're ready there to basically roll our sleeves up and get stuck in, you know, at the same time. But it's a bit like a war situation. You don't put your generals on the front line, you know, until it's absolutely necessary, because you need them to be doing all the things like managing the PPE, making sure that we're getting all the information and disseminating it down. And that's, to me, that's what's kept the service safe, which keeps us a little bit more sane and sort of justifies why we're doing what we're doing. But nonetheless, those guilty feelings still creep in, you know, that we're doing all the essential work that we need to do to pay staff, keep them safe, do all the centralized stuff, but we're just not in it. We're just not there feeling it like they are. So do we really truly understand?
I don't think that's unhealthy though, Jeff, to feel like that.
Oh no, I think
that's
you're right.
important that we do feel like that, because I think it clearly echoes what we're about, and that's we're all caring people, you know. And it doesn't matter whether it's our residents or our staff. We think just as much about them, you know, and probably sometimes it feels like you probably think more of them than you do of your own family sometimes, because of the hours that we put in and the times that we spend with them. You know, it is a second family. So I think that's kind of healthy to feel like that. It might seem a bit perverse, but I think it's really healthy.
Yeah.
Yeah, can I just say something? We were, I think everybody knows we lost Stu, one of our managers and really good friend of mine, and so he was the manager of Lawn Street, and under normal circumstances we would be around there supporting the staff and, you know, and helping out and giving people time off and that, because they were, you know, a very close team, and we weren't able to do that. So, you know, you do feel that guilt. You want to be more hands-on. You want to be able to give that personal touch, but it's really hard to do that. I mean, obviously we've got plans to do things in the future to sort of commemorate Stu and to, you know, allow the staff that you know, that outlet really to memorialise Stu, but that's been difficult for us at the moment. And also having COVID-19 at a scheme, having clients with it, and you're putting your staff in that position as well, where, you know, you're asking them to go in and they've got to go home to their families as well. That's been really difficult, and, you know, we do agonise over that really. I mean, I've been quite lucky really, because I've volunteered to go and drop PPE off and cleaning products. I'm up and down to Costco all the time, and just so I can get out and go around the schemes and stand on the doorstep and see people. And I've been surprised so many times how happy the staff and clients seem to be. It's really strange, but there's a great morale going on. They're doing, you know, their own in-house competitions, and they're doing their own activities, and they really took ownership of it. You know, they don't need us going there holding the hand. They don't need us taking over the management of these schemes. They're doing it themselves, between themselves, and they're like, they really are all in it together. You know, it's amazing really to see. It's made me realise what a strong team we have and how wonderful our staff are. Not that I didn't know already, but, you know, it just sort of reinforces that. It's been really positive. A really positive experience has come from something so negative and horrible.
Yeah.
I can empathise totally with that. I've you know, because it's not just within service as well. It's everything that goes on that is tough for everybody. I think I've just lost basically, without going into any great depth, like my surrogate mother on Saturday, and it's going to be extremely difficult to be able to, you know, mourn her in the normal ways, if you like. So there will be people suffering as well outside of work who work. So we generally think of work being a kind of inside almost like a box, but everybody will have their personal challenges who come to work as well. And you know, and I think echoing Tom saying there, you know, sometimes just coming to work and just having that little bit of general chit chat and, you know, just, you know, talking about almost nothing, you know, can be a massive help to somebody that's going through some little personal issues. So they almost like come to work to park some of their personal issues as well. And we can't have that as much as we have had, I think. You know, you go on a conference call and you've got a very set time or set agenda within that conference call. You know, I certainly make time in our conference calls to spend 5 minutes just chatting to the managers about rubbish, just in the hope that actually they get some of that.
Somebody's going to say it at some time, Jeff. That's, you know, you're the man.
Yeah. 5 minutes, stroke 10 or 15, yeah.
I think what I found really difficult is that the amount of phone calls I get every day from staff at all different levels asking for my advice about COVID-19, and they're looking at me to tell them the right answer, but to be fair, nobody really knows the right answer. And you're at it all day and you're doing your normal job and you're doing the questions, and then actually at the end of the day you just sit down and actually it hits you because I don't think you realise you're strong, you keep going, and you have to do that because it's a service and there's a staff team that rely on you, and you know that. So I think that's what I found really difficult. And the only thing that's probably helped is those clinical calls in the morning, because the guidance is there. So actually, you know what to say, you know, and it changes so much. But actually, it's been really, really good to have them calls.
I think, Paula, in relation, if you take Valorum, the whole thing, the Valorum Care Group, and you then map it against what's happening elsewhere, you know, I can't help feel that the work that you've done on the in the clinical governance group, which then feeds down to everybody else. I mean, what a fantastic job, you know, all you guys in the clinical governance group have done to actually then push that onto the rest of the staff to make them feel safe. You know, I mean, you know, we're talking about almost like our mental health here. You know, mental health is about feeling good as well as, you know, recognizing feeling bad. If you think about that, I mean, what a phenomenal piece of work the clinical governance group have done through this to then actually keep the company in a really positive place in relation to our mental health. Because I think this call would be a very different thing if we were one of those care homes that you hear about on the TV, you know, that have absolutely been clattered by this, you know. So and then seeing as well the staff on Valorum app, you know, press the smiley face, you know, the vast majority of them of that. And from my understanding as well, the worst we've had is basically, well, I'm neither feeling bad or good, you know. So what a phenomenal place to be against such a backdrop of all the problems that we've had, you know, all the challenges we've had. It's phenomenal, and I put that down to just being that much more prepared in our group than the rest of the world, for that matter, you know.
And sharing information, isn't it? That's been really important. Keeping everyone up to date with what we know, not keeping it to ourselves, but letting them know where we're up to. That's been important.
And I think there's been occasions, actually, because I'm part of that group, where actually we have we've put things in place before the government or the NHS, or you know, we've actually put things in place before it's even come out, because experience of people within that group have said, actually, this is the right thing to do, this is what we want to do as a business. And then 2 weeks later, maybe it's come out as this is a recommendation for the whole country. And I think that has you know, really supported the fact that we, touch wood, have been, you know, very hit very minimally by COVID.
And what it's done as well, Esa, I think it's brought the brands further together, which has got to be a positive thing. You know, the relationships that I've seen grow out of this, and I actually said, certainly to our guys before this, you know, this is going to be really tough, but out of this we'll see the cream rise, and we're seeing that in all of our staff, I would say, you know, bar maybe one or two, you know, but the cream's rising, you know, and we're getting to see the strengths of the business where they may have laid dormant, or we wouldn't have seen it, maybe, you know, the superstars that have coming out, you know, the guy in I can't remember his name, is Craig,
Right,
you know,
yeah.
yeah, just people like that suddenly becoming characters within the whole situation, you know. So we're seeing that all over our business as well, you know, which is fantastic.
Absolutely. Robin, you've been very quiet and you've listened to us all. What's been your experience?
I don't think there's a lot more I can add to what everybody's said. I think when Tom said about sort of, you know, roller coaster, I think that probably is the word that I would probably use to sum up, you know, what the last sort of 2 months or however long it's been has been, because I think there's days when you get up and think, right, I'm really going to smash this today, and you get stuck in and do this, and there's other days you get up and you go, you know, it's another day like it was yesterday, you know, and I think the worst thing is, you know, and I think it sort of almost sounds a bit petty, but sort of you get to the end of the day, you don't think you've achieved anything, and I think the thing for me is, and we probably have, but what I sort of take heart from is the fact that, and you've just mentioned there around the sort of the preparation of what we've done and how we face this, and I sort of think about the preparation, and I think about what other companies are going through that we're not going through, touch wood, and I think about the people that are out there doing the job every day, and sort of what they're facing and the challenges that they've got, and I think, well, actually, you know, being sort of stuck in the house is not the worst thing in the world. You know, it's not. At the end of the day, I think there are a lot worse things out there. There's a lot going on, and there are people sort of putting themselves in very difficult situations every single day of the week. You know, and where would I rather be? You know, what is the best of that? And you'd love to help and go into the front line and to really sort of to help the guys. And when I went round with some of the hand gels and some of the biscuits, you know, it was just great to see the work that was going on, and it makes you feel so much better. But that lasts for 24 hours, and then you sort of go back and think, oh, you know, when's this going to end? And it's silly little things, isn't it? And I think sometimes we're all susceptible to being cup half empty people. I think that's just sort of almost sort of human nature, and I think you have to sort of flip the other side of it and say, well, do you know what, I'm actually probably got, you know, more time at home, more time with the family, you know, which a lot of people don't get to do that. So I think you have to balance it out, and I think it depends on what day, and Katie, you mentioned it, whether the sun's shining, as to whether or not you actually feel reasonably good about things. But I think we've got so much to be positive about, and how we face things and how we are facing things, because it's not over, let's be clear, you know, but actually I think there's so much to be positive about that you have to just think about that and just think, actually, there's a lot of people out there that are in a lot worse positions, there's a lot of people that have lost their jobs, there's a lot of things going on, and actually, you know, we're in an industry that we're the sort of front line of this, which comes with its risks, but at the same time it means that we're all sort of sat doing our job and getting involved with it. So I wouldn't say it's been easy. Some days are easy, some days are hard. Some days I don't know what I've done. But I think the way that it's all come together, I think has been absolutely fantastic, and I sort of take heart from that more than anything else. And I take heart from the small things, like we can get into the office a week on Monday, or I can get out and deliver some biscuits. And a bit like Collin said, you know, going to Costco's and taking some stuff to the services. It's the smallest thing you can do, but actually it helps you, and it also helps the services, because they're pleased to see that as well. So I think it's just it's little things, isn't it, that make all the difference at the moment, and that have the bigger impact in whichever way you do it. Yeah.
So just sort of coming off from what Robin's been saying, then it's sort of like a bit of coping mechanisms, like small things to look forward to, and, you know, if you can get out, then you do. I mean, has anyone else got any sort of other coping mechanisms that they've found have been really helpful while they've been at home and
drink?
In yeah, I'm not exactly agree with that one.
Not me on that one. Exercise for me has been a big one, because I you know, would be at the gym, you know, 4 times a week, sometimes 5, prior to this. So I've had to keep a real strict regime of when I would normally go to the gym, what I would do at the gym. You know, it's great weather. I've been lucky to do it in the garden. but also it's the connections outside of work. So my friends. So again, where we were speaking earlier about without this technology, we'd probably be having very different conversations right now. But every Friday night with my friends, we have a few drinks, we do a quiz together, and we don't really speak about anything, just having a real good, you know, I really look forward to my Friday night fun with my friends. And I think if I didn't have that, you know, I love my husband and my family, but I've been with my husband 18 years. I've never spent this much time with him ever. And like Katie was saying, you know, bickering, you know, that happens. So being able to still connect with, you know, my friends, I think is really keeping me sane right now.
Yeah.
Yeah, I found the exercise is what's kept me sane.
Like lifting the biscuits from your plate in your mouth.
Lack of exercise. It's
I
really
think you don't do exercise. The problem is you get into your routine, don't you? And what I found is you don't, you know, you have these great plans, but you know, you come and sit in front of you.
Oh, we've lost Robin. Okay, well, whilst Robin's unfreezing, did anyone else have anything about their coping mechanisms at all? Oh, Robin, you're frozen. Right, okay, we'll move on to a different topic, and then maybe Robin can come back in a second. So one of the other questions that I've got written down for you guys is sort of what mechanisms do you think have worked well for staff in terms of lockdown? And is there anything else that you think that we could do as a company to support our staff? Obviously, there's been quite a lot of initiatives, but it'll be good to know what you think's gone well and what could we do better.
Well, I think the rollout of the app has been massive.
Yeah.
The
Definitely.
rollout of the app and the you know, the incentives, the competitions, the big white wall. Obviously, I know lots of people have been using that right now. But yeah, just giving them. Everybody likes a bit of competition or something fun to do. So like we mentioned earlier, Craig, he's becoming famous now. You know, and doing the 500 miles and things, and just trying to bring a bit of fun back into work, all that, because it is really scary. We've mentioned it a lot that they're on the front line. It's really scary. It's not very nice for them to be in that situation. So anything that we can do to make it a little, you know, little easier for them, I think so the app has been huge.
Brilliant.
I've just seen the comments pop up on the quiz on a Wednesday. Yeah, I agree. We've had some. We built a bit of a social time. I mind you, we missed yesterday. It was, I don't know why on earth we missed it, but we missed yesterday.
Because nobody knows what day it is.
Probably get
Yeah.
I don't know. I've suddenly taken to crosswords, filling in the crosswords. I don't know if anybody's done that.
Yes.
Yeah,
I love them.
Yeah, they are. They're good. So I think the app was good timing, great timing. I don't know if anybody had the foresight, you know, or got this thing coming. We need to get the app. So that was good. I think in relation to going forward, is there anything else that we can do for staff? I think I'm sure there'll be pearls of wisdom out there, but I'm certainly welcome staff giving us ideas of what we could do. You know, if somebody felt that there was something that we could do that was achievable, then we should take those ideas from staff. I'm sure we're all open to that. So.
We could put a feature on the app for like we could put a poll out, something for like a week for people to submit suggestions, and then, you know, we could say that we're going to put it to a panel and see sort of which ones are feasible and can we, you know, how long would it take to roll out, etc. So yeah, that's absolutely something that we could look to do. That's not a problem. Absolutely. Did anyone else have any comments on sort of mechanisms for staff?
Yeah, I mean, I think it's been difficult for a lot of people, especially with young children, and you know, being off school and maybe not in school every day. So we've allowed a lot more flexible working hours for our teams, especially the managers. You know, normally doing Monday to Friday 9 to 5. They've been doing long days and working opposite their seniors as well. So you know, we can get like a good leader in, you know, throughout the whole week. Things like that I think have really helped as well. I think they're really enjoying having that flexibility. It's probably a bit too much, but things will go back to normal soon, I assume. Yeah, that's helped, I think.
Yeah, and I think for me as well, linked into the app, I know we all keep coming back to that one, but actually that gives us so many opportunities for how we can better communicate with the workforce, and how we can all feel part of one big family. That's certainly how I felt using that app. It's just made me much closer to lots of people that are out there just posting lots of comments. And I think things for the future is going to be around employee of the month and all, just those engagement programs. That for me would be a main one.
Yeah. Absolutely good. I think the running total, when I last checked on the analytics, we had about 750 users signed up to the app. So, we've got a good chunk of the workforce that are on there. I just really urge everyone to, spread the word, get all your colleagues on there and your peers on there, because I don't want anyone to miss out on any of the fun, on any of the updates and any of the resources that we've got put on there as well. So anyone that's listening or watching this, please do spread the word.
Yeah, I'm about to do an exercise video and post it on there quite soon.
Are you?
Wait for everyone else to do theirs, but I tagged more than you, Tom.
I was just he's like suddenly shrank away in the screen there, hasn't he?
The challenge is we want to try and increase the number of people on the app, not reduce the number of people on the app. So I think certain numbers of us shouldn't be doing anything on the app, otherwise it'll discourage the use, I think. Yeah.
Clearly, that's the other Tom you're referring to there, Robin.
I'm not casting any aspersions on anybody. If you take that comment personally, I apologise. So.
Okay, so I think we've covered quite a lot of different topics. I think maybe the one to sort of wrap up with and to leave it on a bit of a nicer note is to look at any positives that have come from being in a lockdown scenario. So I know, Robin, you've mentioned obviously being able to spend more time with your family, but have people got some what positives have you been able to take from being in lockdown? Because it hasn't all been doom and gloom and hard. Does anyone want to go first?
My dog would probably say he's really enjoying having us all at home.
Yeah.
The company.
Yeah.
I've been enjoying doing a lot more cooking, so I've got a bit more time to prepare an evening meal rather than just coming home and trying to throw something together. So that's been really, really good. And again, taking the dogs for a walk, they actually bark now. I've had to put it on mute because I've come home and they're just waiting for me to take them out. So they seem to know. So God help me when I go back, what's going to happen with them? They're going to go wild. But yeah, I've really enjoyed the time, and less travelling. I feel better for it than sat in the car all the time. So I had a bit of a dodgy back, but it's a lot better. So yeah, I've enjoyed it.
Good.
My dog is definitely also very happy. And my son, I asked him actually, because somebody asked me today, I bet your son's loving you being at home, and I didn't know the answer, so I asked him, and he said yes, because obviously Monday to Friday I could be in hotels or wherever. I'm not home full time, so he's been enjoying having me around. And I think it's also made me re-evaluate in a good way how I spend money.
I've been able to spend more time with my family. I think I'm generally the first one to bed. And it's been nice without the travel and the tiringness of travel to be able to last the day a little bit longer. You're off in the morning, you have the full day at work, you're home late, you want your tea, you just want to go to bed. It's been nice to sit up and talk and watch a bit of entertainment with the family, which as I say, probably haven't done for quite a while, really. I'm always the first in bed. I'm the last now,
Yeah. Good.
Paula, I think I can relate to you as well. It's I've coined a name for myself now. It's Chef Le Chef. So yeah, we have an argument, Sarah and I. We have an argument because she thinks she's the chef and I'm some sort of cook or something. She says, but because but I'm actually a chef. I'll let you into a little secret. I won a competition, junior master chef, when I was a kid.
No way.
Yeah. But don't ask me what I made.
I was going to ask if is that on? I was thought that would be on Catch Up TV or something, but I don't think they do black and white stuff anymore, Jeff, do they?
No, I don't think they do. No, I made this salad sandwich.
How old were you?
I think I was about 5 years old or something like that. Might have been even junior master chef. I can't remember, but I know I won it.
Well, I'm glad that you guys are enjoying your cooking, because one of the initiatives that we're thinking of in the background is where we're going to create some of our own home videos of cooking, and like maybe health and nutrition as well. So start thinking of some healthy ideas that you wouldn't mind filming.
It's not healthy, but curry and naan bread and Bombay potatoes I've now got down to a T. I don't need a takeaway anymore.
Yeah.
Flatbread. You don't need. Flatbread's the future. That's what we've learned.
They're so easy.
Yeah, it is. Yeah. Bit of yogurt and bit of flour. Yeah, brilliant.
Barbecue every night in this weather.
Yeah.
I sometimes think that as much as I sort of, when I sort of cheer myself up about thinking, well, what are the sort of frontline people? They're still doing the same things and they're facing all the sort of challenges. I sometimes sort of think the other way when I'm thinking, well, actually, I'm able to work at home and see sort of more of a family. I actually think the other side of it and think, but actually, a lot of people that are working for us, that's the opposite. That's the opposite for them. They're probably actually either working more hours or they're more involved in the service and everything else. So I always think, well, sort of, it's a great opportunity, and I've sort of boringly almost sort of tried to do the same things that I've always done, because I think if I try and sort of deviate too much from the routine and do things differently to actually get back into how I was working before would be very, very hard. And even now I sort of worry about getting up in the morning. Not that I don't get up early anyway, but I'm probably get up an hour later than I do normally, so I get up at 6:15 instead of 5:15. So I always sort of I've tried to keep a sort of a positive routine, but keep doing the same things and not change too much, because otherwise I just think it's a real risk.
Yeah, Robin, getting the crystal ball out, and you're in a greater position than probably most of us do, because of the various different panels you sit on, etc. And this is probably one for staff for the future. It took a pandemic, in my opinion, for the government to sit up and take note. We finally got a health secretary that realizes he's actually got another element to his job in social care, which he never used to acknowledge in the past, and we've got this great amount of public support for what our guys now do. It's out in there, we try to highlight it in the home free thing that we did, the program that we did, and it got really good viewings that people could relate to the work that we've got. So if I was to put a silver lining on this, if I can, aside from people unfortunately losing their lives to this and all the rest of it, we've got a phenomenal opportunity to change the public perception and hopefully the political landscape on this. Because we've obviously had in the past challenges over recruitment, which I suspect will be slightly alleviated, because unfortunately people will be losing their jobs and maybe need to refocus and rechannel. So can you see a position where staff will potentially do less work in the future, but because the political will is there to actually, recognise staff through their pay packets? Do you think in the future that'll come about?
I'd like to say yes, but I'm not. If I'm honest, I sort of see lots of really positive things that are happening, and I think a lot more recognition for staff and a lot more kudos for social care, which I think is really, really important. A lot the days of sort of the NHS is at the forefront and the social care is a long way behind it. I think are starting to sort of disappear, which I think is really, really positive. Do I think the world will change significantly? I mean, I unfortunately I take a bit of a cup half empty view of this, that everybody's creature of habits, and when this has all sort of died down and gone away, then probably everybody sort of reverts back to how it was before. Do I think in the short term where the sector is and where it's going is a positive place? Absolutely. I think it's probably within all of the people on this call, various other sort of leaders within the care sector to keep that at the forefront of government's mind, because I think we are going to hit that crossroads of real sort of positivity for social care. We need to do more and invest more and move the sector forward, but we're also at the same time going to hit austerity as well at some point. It's inevitable. So how do you meet that crossroads of we need to invest more money into healthcare and push that forward at the same time as, well, we spent billions of pounds on COVID and we need to cut back? So I mean, one of the things right at the beginning of this conversation, we talked about how we planned, you know, how we planned for this and the preparation that went into it, which I think was, you know, has been absolutely fantastic, and the involvement from everybody, and everybody should be really proud of that. And I think, and that all started from a conversation. And you remember it, Tom? You sent me an email one Sunday afternoon in January saying, COVID sort of, it's not here yet, but it might come. What do you think? Do you think I should get something out just to sort of let people know that to be vigilant? And it all started from there, you know. And Tom, you may remember, Katie, you might remember it, and Tom, for you might remember it. On the office, in the old office, and when we had that front office, on the wall we had a couple of whiteboards, and I wrote something on the top of one of those whiteboards, yeah, and it said, "Success occurs when opportunity meets preparation." Yeah, and I think at the moment, you know, for me, the takeaway I would have from an organisation and from everybody that works for the organisation perspective is that we've created, we have done really well through the planning and preparation of what of where we are. It hasn't gone away, but we've done really well so far, you know, and I think we planned for that. And I think unfortunately out of difficult circumstances, opportunities occur. And I think because of how we've handled this and how we've worked and how we've built relationships and developed, then I think there is a great opportunity there for us as an organisation to build on what we're doing. And I don't always look sometimes too far outside of the organisation, because what happens at government level can take 10 years to get down to us. So it's about us influencing locally in what we're doing. So for me, you know, I think if we want to take a really positive slant from, I think the team, everyone's worked so hard, and I think everyone's, you know, I think about us taking opportunities as a company, valuing our staff really important, and taking that forward.
Yeah.
Yeah.
And I know that a lot of us on this call, I mean, I've been writing to MPs, local MPs, commissioners, you know, really ratcheting up the pressure. We've been on calls, Robin, as you know, it's ratcheting the pressure up on the local authorities to make sure that they pass on every little bit that they can, because there is, you know, there has to be a day of reckoning to government that these, you know, our staff are a massive part of society and need the recognition. You know, it just in every way as the public expects out of the NHS. I think now there's a realization, there's an expectation it needs to be passed on to social care as well, you know.
I think the biggest thing for me is how there's money and it's right that we want more money for people. We want to pay people more money, and I think hopefully that will be the case. But the thing for me is it's about how we value people that work for us, and whether that's the person that's a domestic in one of the services, or whether they're a manager or what, you know. And I think the fact, you know, we're all responsible, and I think that, and the people that work for us are all responsible for saying thank you to the people around them. Thank you for helping with that, and I appreciate your help, or I appreciate you picking up that shift. And it's just that little thing that actually you can't quantify with a monetary value. You can only quantify it by actually saying thank you, or I appreciate that, because then I think people go away thinking, I appreciate what you know, what people are doing. And I think we're all, you know, everybody on this call, but also wider across the business, it's really important, those little things, you know. You know, and I guess I'm in that position where, you know, sort of as the sort of the leader of the organisation, I don't have a boss in reality. I don't have, you know, we have a board meeting and we have, you know, we go through the various things, but actually, you know, you don't have that interaction at that level where you've necessarily got somebody saying that's great, well done, that's fantastic. You know, and that's not what we want. We want across the organisation for us as leaders to say thank you to each other, appreciate that, but also sort of further out into the business. And I think if we can really drive that culture, then I think the money and everything else sort of comes behind. I'm not saying it's not important, because it really is important. It really is important. But actually, it's, you know, at the end of the day, you can sit there counting your money all day long, but if you don't feel appreciated and you're not happy, it makes absolutely no difference whatsoever. And for me, it's those little things that make all the difference, that have probably helped us over the last couple of months, that we should embrace and carry on for future. So doing it through the app, doing it through calls, speaking to people, just the little things that make all the difference. And that's the thing for me, you know, it really will sort of support everybody in the business from a mental health perspective to for them to think, you know what, actually I do like my job, I do enjoy what I'm doing, I do like to go to work, or I do like the people I work with. And it's just those little things, because at the moment that's really important.
Yeah, absolutely. I think that kind of concludes this sort of boardroom talk really nicely. I think we've all been on the roller coaster, but we value our staff teams immensely, and I hope that everyone sort of enjoys this video. Though, thank you to those that have joined in live. As I say, we will be putting the this recording on the app for people to see, and we'll share it for everyone else who's not quite yet on the app, although we'd prefer them to obviously be on there. But yeah, it's just a massive thank you to all of our staff. You know, from everyone on this call, all the way out into the services. You know, we've done a really good job so far. So, thank you.
Teamwork.
Yeah,
So it's all about teamwork. Yeah.
Yeah, absolutely.
Yeah.
Yeah,
Brilliant.
thank you to everyone on the front line.
All right then.
Yeah.
Thank you for your time this evening, guys.
Thanks,
Thank you.
everyone.
Thanks, everyone.